honourable member for Vermilion, Lloydminster.
Mr. Speaker, I'd like to preface my comments by stating that certainly the PC caucus and Manmeet's family has been greatly appreciative of the support that they have received outside of this chamber, but I also want to say the PC caucus is highly appreciative of all of the support we've received from inside of this chamber, particularly from the House leaders, from government, from the official opposition, and also from our independent members. To modify the rules under these extraordinary, exceptional circumstances, and we appreciate it, and especially to the official opposition caucus for affording us 4 additional questions so that we might be able to all ask questions. Mr. Speaker, amongst Manmeet Bhullar's many passionate causes, and there were many of them, one that is perhaps a little bit less known is that he was a passionate advocate for midwifery. Midwifery has been recognized under Alberta's Health Professions Act since 1998, and 1 year after Manmeet was first elected, midwifery was funded by Alberta Health Services. He was a passionate advocate for the expansion of midwifery services in Alberta, and he understood that a good life began with a good birth, and that he knew that skilled and compassionate midwives would provide these services to women across Alberta, the women he so affectionately called his mothers and his sisters. To the Minister of Health, what expansion of midwifery services has Alberta seen since 2008?
Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the question. The number of midwives in Alberta in the initial first year, 2009, when it became publicly funded, was a 37% increase in that year alone. And now there are approximately 90 midwives and midwifery staff appointments through Alberta Health Services, which is great. And so, you know, in the very first year it was funded, my niece, Annika, is proud to say that she was helped out by a midwife. So it certainly impacted our family in a personal way, and I want to say thank you for the contributions.
Supplemental.
Mr. Speaker, one need only speak with Manny's mother and his sisters or his beloved wife to know how much he honored and valued the role of women in our society. Now his love for children is also very well known, and the fruits of his efforts as a role model and mentor to hundreds, if not thousands, of young people will be seen for many years to come. To the Minister of Health, in September, additional funding for midwifery services was announced. How many additional courses of care will be provided this year, and how will women be able to access these expanded care courses?
Thank you very much for the question. More than 2,700 families will be receiving midwifery care in the coming year. That's an expansion of more than 400 supported midwifery births. And there's actually a centralized database now through the midwifery website. And there's a number of communities that it's been expanded to, and some actually are still accepting new registrants this year. So good news, we haven't totally exceeded our capacity yet, and obviously the demand is going to continue to grow with the expansion of this great service. Thank you, Mr. Speaker.
Second supplemental.
Mr. Speaker, Meeta would want us to continue expansion of midwifery services, and not just in the number of courses that we offer, courses of care, but also in the opportunities for training new midwives in Alberta, and for expanded availability of midwifery to all geographic areas of the province, including rural and urban areas. Could the Health Minister share with Albertans her plans for fulfilling Manmeet's vision?
Minister.
Thank you, Mr. Speaker, and to the member for the question. We are certainly working closely with Mount Royal University and with the College of Midwives of Alberta to understand their needs and ensure that they understand the needs of women throughout Alberta. The expansion of midwifery services, I'm really proud to say, just this November we expanded to the community of Plamondon, so that's great news. Additional midwifery services have also been recently added in other communities, in addition to Edmonton and Calgary, which are the two where we have the current greatest demand. We also have expanded services in Cardston, St. Albert, Medicine Hat, and underserved communities in northeast Calgary and surrounding area as well. Thank you.